flu season is upon us once again, and according to the Centers for Disease Control and Prevention, last year's influenza season was one of the most severe on record, with more flu-related deaths and hospitalizations than in past years. Today we have Dr. Benjamin Chan, state epidemiologist, joining us to talk all things influenza. So Dr. Chan, thanks for joining us.
My pleasure, thank you.
We're nearing the end of October, and of course we're getting into that time period when people should start to think about a vaccination. When should they get that done?
Good question. So in the last couple of weeks, we've had a few flu detections in New Hampshire already. So we know that the flu virus, that is the influenza virus, is beginning to circulate in New Hampshire communities. And so now is the time to start to think about taking steps to prevent flu. And the primary way we do that is vaccination. It's important to remember that influenza is different from the common cold, right? So influenza tends to cause more severe disease. As you mentioned, it can cause hospitalizations and deaths. And this year actually marks the 100th anniversary of the largest flu pandemic in human history, when there were more than 40 million deaths worldwide back in 1918 from the flu pandemic, including upwards of 700,000 deaths in the United States. So flu can cause severe complications. The vaccine is the best way to prevent influenza infection and those complications, and it's recommended that people get vaccinated by the end of October before flu is widespread.
And we know each year there's a different vaccine. Tell us about the vaccine this year and the people for whom it's particularly important.
That's correct. So every year the flu vaccine contains 3 or 4 different strains of the influenza virus. The flu vaccine this year has 2 updated strains out of those 3 or 4, and the strains include those that have been found in past seasons' vaccines. It's important or it's recommended that everybody 6 months of age or older get vaccinated against the influenza virus. It's particularly important for those who are at higher risk of complications of the flu, so that includes people that are very young children, more elderly adults. Pregnant women should get the flu vaccine every year. People that live in long-term care facilities or nursing homes, and those with certain medical complications should get the flu vaccine, and that includes people with heart disease and diabetes, chronic lung disease as examples.
So we know that it's important to get vaccinated. There are a lot of people out there, we were just talking about this, I've got to be dragged kicking and screaming to this thing, but the message to people, it's not just about me, it's not about you, there's a bigger thing here at stake.
Correct.
Why is that? Why is it so important?
Well, so the flu vaccine protects not only the person getting vaccinated, but also others around them who may be more susceptible to flu and the complications. And it's important for people to get the vaccine every year for a couple of reasons. The first is that the strains that are circulating change, and as I mentioned, a couple of the strains have been updated in this year's vaccine, but also someone's protection decreases over the course of a year. Their antibodies, their immunity wane, and so it's important for people to get reboosted every year with the vaccine. Now, the flu vaccine is not 100% perfect. People can still get the flu, but the flu vaccine, we believe, can help prevent more severe disease and hospitalizations. If someone thinks that they do have the flu, there are antivirus medicines that can be given to prevent, limit the duration and prevent more severe disease, and people can call their healthcare provider for those medications. They're particularly recommended for those that are at higher risk of complications or with severe disease.
All right, Dr. Benjamin Chan, thanks for the info. We appreciate it.
My pleasure. Thank you.